My name is Marisa, and I'm the court administrator and clerk of court for the city of Westerville. In May of 2009, I did the Cap City Half Marathon, and afterwards I had quite a bit of pain in both of my feet. I went to talk to Dr. Davey about the pain that I was experiencing, and he diagnosed me with tendonitis, told me to lay off a little bit. I didn't, and 2 weeks after the Cap City Half Marathon, I was running the Columbus 10K. And while I was running the Columbus 10K about mile 4.5, my ankle snapped. I flipped, I landed on my head, I stood up, and I said to my husband, I think I just broke my ankle.
Marissa's injury was a variety of a very common injury. It's an inversion injury where an ankle sprain occurs, damaging the ligaments and or the tendons in the ankle. She's a great patient because she'll come in and she'll say, I did this, and how do you fix me? I want to get better.
I've been in sports my entire life. I cannot sit still at all. So when I was sidelined, it was hard. It was really hard. The decision-making process for having a surgery is not easy. And I've been through this before. Dr. Davey didn't just jump to surgery as the first option. And that's what I liked too. He wasn't anxious to cut into me. He wanted to make sure that we looked at all options available.
Generally with an ankle sprain, almost all of them are treated conservatively first. Before attempting surgery, the gold standard is to undergo conservative treatment such as boots, braces, physical therapy, injections, anti-inflammatory pills. When the patients failed that, like in Marissa's case, she was unable to overcome her injury. The ligament damage and tendon damage was too extensive. So she became a great surgical candidate. The great thing about OhioHealth for foot and ankle care is that there are so many surgeons that do this on a daily basis. Their level of experience is so high that their outcomes are exceptional.
It's just an ankle surgery. It's not life-threatening, but surgery is still scary. I kept my parents informed what my process was, where I was in the operating room, in recovery. They had coffee and water, and they made sure that my family was comfortable too, not just me. They had everything on site right there. So when I needed a cast, I just moved over to the next room. When I needed an x-ray, when I had to get stitches out, everybody was right there, easy to work with, always compassionate.
It's an extremely gratifying experience, especially for patients like Marissa who get everything they want out of the procedure, and oftentimes they'll send photos or send you notes and tell you how they're doing on big trips or hikes they couldn't have done before.
I was so scared and so nervous to run again, but once I got out there and got back on the pavement, it felt really good. And then that following October is when I ran my first full marathon. When I crossed the finish line after doing that, I cried because I felt like every time I got close to accomplishing goals, I was always getting sidelined because of injury. One of my goals on race day, not only to just finish it, I had to get the picture holding my medal because I was going to send it to every person that helped me get to the finish. When you go to OhioHealth, you're going to get the attention that you need, and you're going to get the focus on you as a person, as well as what your goals are and how to get back out there.